Now, Jonathan, in the book, you've described or even mentioned just briefly some of these dynamic flows that are part and instrumental in the new health age. Tell us a little bit more about what those dynamic flows are and what they mean to the future of healthcare.
Yes, the 9 dynamic flows that David and I have come up with to describe the future of healthcare in America really center around 3 core areas. One, how we think about healthcare is going to change, how we deliver healthcare is going to change, and the economics around healthcare are going to change. And really, when you go back to one of your first questions, Charles, what is the new health age? We spent over a year researching this topic and really wanted to try to drill down and take a lot of the noise out of the debate and the discussion that's occurring in America today about healthcare. Right. Drill it down into some very succinct, understandable concepts that people could relate to, and that's what these 9 dynamic flows are about. So just to give you a few quick examples, sure. One under the thinking flow. When Americans think of healthcare today, so many of us think of healthcare as where we go when we are sick or when we are injured. And it's not that in the 21st century sickness and injuries will go away, but we're going to think about healthcare in a much more broad sense of the word and much more inclusive, and include wellness, prevention, and the concept of a holistic system. Where we look at healthcare as where we go to prevent illness and to stay well versus just being reactive.
Reactionary.
Exactly, reactionary. On the delivery side, another flow that's major for the future and is occurring today is integration. Today, healthcare to a large degree functions in silos. Perfect example of that is, let's say, hip surgery. Patient falls, breaks their hip, taken to the emergency room, diagnosed broken hip, transferred to the OR, surgery's done, transferred to the floor, maybe discharged at that point in a few days, goes to rehab, goes to physical therapy. All of those episodes and episodic treatments are very siloed. Healthcare is going to become a lot more integrated moving forward in the sense that you're going to have more parties coming together, coordinating the care through technology, through joint ventures, through agreements, and through the payment system. So a lot more integration. Then speaking of economics, we're moving into a performance-based model under healthcare. I mean, as David said under the 80-20 section, think of all of the areas of America and in our economy where people get paid for their performance.
Exactly.
You know, the top performers get paid more than the low performers. All of that economic incentive program is coming to healthcare. Those that produce the best results, the highest quality, the low infection rates are going to get paid more than those that don't. It's going to be an economically driven and motivated system.
If I could jump in there, Charles. You know, one of the reasons we wrote this book is the current conversation about healthcare reform is driven by misinformation, fear, and manipulated by politicians. And so sometimes it's easy, the way to think about it is just to think about it very easily. Like Jonathan just mentioned, integration. So think about how you buy an airline ticket. Now, you just pay once, right? You don't have the ticket agent charging you, the baggage handler charging you, the flight attendant charging you, the captain charging you at all. I mean, it's all integrated, and yet in healthcare, each one of you get an invoice from each one of those. Just in that hip surgery situation that Jonathan mentioned, there are about 3 different invoices you would get that you would have to figure out, and you don't know whether it's valid or not, and you can't comparison shop. So just think about the way you buy an airline ticket. That's the way you're going to be able to look at healthcare, and it's going to be integrated.
And imagine the cost savings that what David and I just described will bring to America. We haven't talked a lot about that, but that's at really the sort of the core of the 20th century model, and what we're having to move away from in the new health age is controlling the cost of healthcare.
There isn't anybody listening to this program that didn't at some time in their childhood hear an ounce of prevention is worth a pound of cure. And right now we have a medical system that's paying the pound of cure rather than the ounce of prevention. There is no way a doctor under the current healthcare system gets paid for keeping the patient well. They only get paid for treating sickness.
But what about the transitions? I mean, are transitions from a present system to new methodologies, are those going to be difficult? And what kind of resistance can you see in the future?
Well, as a futurist, I look at movements and transitions. Transitions are always difficult because most people can't see where they're going, so they don't know, they can't embrace something better. They're nervous that it might not be as good. And also in any kind of transition of this magnitude, there is going to be an increase in cost before cost goes down, because there's the old system in place, the new system has startup costs, and it's only in probably the second or third year in this country that we're going to start to see healthcare costs go down, and then they're going to start to go down dramatically.
One that we're really very excited about, and it's been a concept that's been around for a while, but it's finally taking life, and that's called the medical home. The concept of the medical home is that there will be a healthcare team led by physicians, as it should be, because physicians ultimately are the, certainly the clinical guiding profession in America. But so it will be led by physicians, but it will be truly a team of healthcare professionals that create this holistic, looking at the entire life body experience in the new health age. So for instance, you'll have dietitians and nutritionists on the team to try to work with families on how to eat right, control obesity, and keep the right nutrients and balance from a nutrition standpoint. You'll have behavioral health folks on the team, because so many of our lifestyle choices that may not be the best options for us from a health perspective, they're lifestyle choices, and behavioral health folks are going to really be sort of at the forefront of helping us make better choices for our life and for our health. And stress management. Many chronic diseases have their root causes back to stress. So you'll have a lot of stress management as part of this team. And then when folks do have chronic diseases impact their lives, whether it's heart disease, COPD, meaning a pulmonary or lung problem, diabetes, then certainly specialists that focus on in those areas will be critical to be in that medical home environment. So medical home is really going to be the core model of where healthcare is moving, to look at that prevention, look at that wellness, create that holistic experience to prevent disease from occurring in the first place. That ounce of prevention will save us so much money long term.
And one of the things that we concluded after this year of research is that it's going to be the America's corporations that are going to lead the way. A lot of people may have heard of the Accountable Care Organization. We think it's going to be the Employer Accountable Care Organization. Simply put, American corporations are no longer competitive in the global economy because they have this extra healthcare line item cost that they have to pay that companies in Germany, Europe, China don't have to pay. So employers are going to take charge because they'll understand that healthier employees or more productive employees will show up for work, absenteeism will go down, and that will lower the healthcare costs. So it's not that the government is going to lead the way. The government has just said this is the direction we're going, and corporations are going to get it done.
Well, I believe the example that you used and put that in was Boeing.
Right.
Where Boeing has a line item of healthcare.
I think it's $2.3 billion. So think of them competing to Airbus, or think of General Electric with the $3 billion, as I've been told, line item cost of healthcare, competing with Siemens or somebody like that. So it's really, you have to look at it holistically. In this global stage of human evolution, in the global economy, that's one of the influences that is impacting this change today in our country. We're the United States of America. We're a land of freedom and choice. So employers are going to say you're 75 pounds overweight. They have an employee that's 75 pounds overweight.
Right.
They're going to say they're going to do all the things that Jonathan just said. We're going to help you with your nutrition, give you a personal coach, help you lose weight, and we'll give you $1,000 at the end of a year if you do that. Well, if I don't want to do that, okay, so then we're going to charge you $150 or $200 more a month for your health care because you're a higher risk. That's what you need to know, that 70% of all health care costs in this country today are absorbed by 10% of the population. So if you can reduce that by 10%, you're reducing costs by 7%. Very simple.
Another quick example of just great economic motivation for the delivery system is shared savings and paying them for making a population group healthier. You know, David mentioned the employer models. In America today, the average employee costs $12,000 a year to an employer to insure. So if you can put together this medical home model, be proactive, focus on wellness, prevention, and all the things we've talked about,
Right.
payers will share some of the savings around that $12,000 with healthcare delivery providers, physicians, et cetera. Bring it down from 12 to 10. We take 1,000, we'll give you 1,000. So major, great, exciting models coming down the pike.
What is the future of healthcare?
Well, that's where I get really excited. And I've been talking to audiences all around this country, and they get excited. I tell people, stay alive, stay healthy, because in the next 10 years, there's medical miracles. For example, genetics. Anybody listening to our voice, in about 2 years, will pay $1,000 to have your entire genetic map done. So you can anticipate, you can find out what genetically is in your body and start treating it before it happens. Think about that. Or think about the fact that you'll have complete eyeballs as good as the ones you were born with, being able to be implanted in 2 or 3 years. Our body parts will be better than the ones we were born with. So I say to people, anybody over the age of 40, stay really healthy, because in the next 10 years, there'll be medical miracles that will keep you alive. So to answer your question about 2015, 2020, 2025, I think 2015 is when this country is going to realize the new health age, and it's going to be better understood. People are going to feel healthy. Costs are going to come down. Everyone's going to get excited. By 2020, those medical miracles I just referred to will become much more commonplace. Healthcare costs will go down, and 2025, you know, and we can talk about this in a second about this idea we have to really mobilize the United States of America to become a much healthier country. So I think 2015, we're going to notice it. 2020, we're going to be living it, and 2025 will be a transformative time. All across this country, people have asked me, are we going to remain a great country? And we have a vision deficit. The last vision we had was this race to the moon, or beating the Russians there. Yep. So, you know, I want to look into the camera and to say to all you viewers, by 2025, join us to the race to a healthy America, to become the healthiest country in the world by any metric. It's very simple. It's a very simple action, and we can all come together rather than talking about our differences. Let's join together and become the healthiest country in the world by 2025.
We're going to invite you back in 2025 and just see how healthy
I'll be here. Right. I will be here.
Probably healthier than ever. This is a very important book, and I would encourage people to pick up a copy of this. If you're a family member or you know, a business person, this is an important book for you to understand. It's going to be available on Amazon.com and BarnesandNobles.com. So pick up a copy and make sure that you can understand that. Endorsed by Dr. Oz and by 2 gentlemen here who have really put in a lot of work and effort, and a lot of love goes into this book too. I mean, you can tell that there's just a great deal of information that's really relevant for this nation. So gentlemen, thank you very much, and we'll hope to have you back at another time. Perhaps we can talk about that race to a healthy America.
Absolutely. Charles, thank you.
Thank you so much, Charles.
And thank you, gentlemen, for joining us, and thank you for joining us. Thanks, David. And thank you for joining us on this special edition of Up Close on METV.